Hello, my name is Ciana Wagner, and for my project, I have chosen the topic of vaginal cancer. In this presentation, I will include the types of vaginal cancer, risk factors and symptoms, treatment options and procedures, the doctors that are involved, prevention, and vaginal cancer rates by race and ethnicity. Types of vaginal cancer. Squamous cell carcinoma is a slow-developing cancer that begins in the squamous cells that make up the epithelial lining of the vagina. Adenocarcinoma begins in the gland cells. Melanoma develops from pigment-producing cells that give skin its color. And sarcoma are cancers that begin in the cell of bones, muscles, or connective tissues. Other cancers that can lead to vaginal cancers include cancers of the cervix, uterus, rectum, or bladder. Risk factors of vaginal cancer include age, attributing over half of cases of vaginal cancer to women over 70 years of age, the use of DES, a hormonal drug that was given to some women to prevent miscarriages, vaginal adenosis, a condition in which the vagina is lined by glandular cells instead of squamous cells. Also, having HPV or genital warts can increase the chance of contracting vaginal cancer. Cervical cancer also increases this chance. Smoking increases the chance by 50%, and other risk factors include alcohol, HIV, and vaginal irritation. 8 out of 10 women with invasive vaginal cancer have symptoms of abnormal vaginal bleeding, abnormal vaginal discharge, a mass that can be felt, and pain during intercourse. Some symptoms of advanced vaginal cancer can include painful urination, constipation, and continuous pain in the pelvis. Some treatments used to treat precancers of the vagina include laser surgery or vaporization, which is using a beam of high-energy light to vaporize the abnormal tissue, and topical treatments that put the drug directly onto the cancer. For invasive vaginal cancer, the 3 main types of treatment include radiation therapy, which uses high-energy rays and particles to kill the cancer cells, surgery, which is used to extract the tumors, and chemotherapy, which is the main treatment for vaginal cancer that has spread, used to shrink the tumors before surgery. Doctors that are involved with the treatment of vaginal cancer include a gynecologist who specializes in the disease of the female reproductive tract, a gynecologic oncologist who specializes in the treatment of cancers of the female reproductive system, a radiation oncologist who uses radiation to treat the cancer, or a medical oncologist who uses chemotherapy and other medicines to treat the cancer. Prevention of vaginal cancer include avoiding HPV exposure, such as using condoms, getting vaccinated, not smoking, finding and treating precancerous conditions, and having regular Pap tests and pelvic exams. Finally, here's a graph that shows vaginal cancer rates by race and ethnicity. The rates shown are the number of women who were diagnosed with vaginal cancer for every 100,000 women. Thank you, and I hope you enjoyed my presentation.